The 35-year-old man had, according to his parents, struggled with issues of delirium and paranoia in the run-up to his death. Just over a month before, he attempted suicide and was kept under observation in the intensive care unit and seen by a psychiatrist. A care plan was put into place for him to be admitted to Ocean Views once he left hospital. According to doctors, he showed signs of positivity and remorse for his actions during his time there. The psychiatrist told the court that the man denied having suicidal thoughts. He added that a different psychologist then saw the 35-year-old and took the decision to send him home instead, following these improvements. He was then given a follow-up appointment for 1 month later. During the inquest, his parents told the court that it was negligent of professionals to send him home after his overdose. They added their son would seem all right during the day, but would suffer high fevers at night time, which would prompt delirium and paranoia. In an emotional testimony, the man's father told the court that he believed mental health issues to be taboo in Gibraltar, adding young male suicides were an issue we are seeing too much of on the Rock. He highlighted that his son wanted to go to Ocean View's mental health facility and was not admitted. The parents took him to A&E, concerned for his well-being. He was seen by a doctor for, they claim, 5 minutes and sent home. They had requested he be seen by a mental health professional, but this didn't happen. A few days later, his follow-up appointment took place, and the psychiatrist deemed him not to be a threat to himself. Pathologists during the inquest found no signs of foul play and a large amount of alcohol in his blood. The coroner, stipendiary magistrate Charles Pito, ruled the cause of death as suicide, given that he had made food provisions for his dog and said goodbyes at the bar, as well as a previous attempt to harm himself. The man's parents told the court they had 3 recommendations for healthcare services based on their son's experiences. Firstly, there needs to be more follow-ups for individuals with mental health issues in Gibraltar. There should be consideration given to the family's view of their relative's state of mind, despite the fact they are an adult. And finally, more support for families caring for someone is required. They also recommended a ruling of negligence or neglect to the coroner. However, he said these verdicts in law have very specific requirements and did not apply to these incidents. Though he agreed a month wait was too long, he pointed out we did not know if it was on medical grounds or due to supply and demand issues with the health system, adding that no one knew if the review date would have changed, if that would have changed the outcome. He told the parents that the matters they raised about the inadequacies of the healthcare system are best followed up with the health authority and not with the courts.